if I have these symptoms, does it definitely indicate cancer? Please pay particular attention to your weight, and especially in combinations with the other symptoms that I mentioned before, you should definitely pay a visit to your doctor. Cancer, and it doesn't matter what type of cancer, and there are many different types, usually does not cause any symptoms in the early stages. And that is the tricky, the dangerous thing. However, there are several warning signs that may be an indication to a malignant disease. And there are 3 symptoms, also known as so-called B symptoms, that you should know, that every one of us should know. On the one hand, these symptoms are non-specific, which means they can also have completely harmless causes. These symptoms occur quite often, and many of you have probably already experienced one or another of these symptoms. However, if these symptoms occur in combination, then it is actually a pretty sure sign of cancer. That's exactly why I'm explaining this to you now. It is important to recognize these signals in a timely manner, and thus to maximize the chance of healing the cancer. Because that is very crucial. The earlier cancer is detected and treated, the better the chances of recovery. But, very important, especially on this topic, to emphasize this again for me, the 3 symptoms I am about to mention can, but do not necessarily indicate cancer. And there is also this saying that fits here: rare things are rare and common things are common. You should also always keep that in mind. The decisive factor here is the combination of symptoms, and also whether there are other signs as well, as I have already explained in this earlier video linked here. That's why I want to use this video to make you aware of possible signs of cancer, but not to worry you too much. I do not want to make you panic, spread panic, or scare you unnecessarily. But you should know, especially if you read this, if you Google for information for cancer, if you watch other videos about the topic, that the chances of recovery are always best through early detection and then early treatment. And you should know what these signs mean and how to differentiate between them. Hello, my name is Dr. Tobias Weigel, and with my YouTube channel, I would like to make a contribution to providing medically understandable and correct information. I would like to inform you about illnesses, and cancer is a disease that we get very often and that can very often be fatal. And if you don't want to miss anything or want to know more about it, then please subscribe to my channel now. More than 500,000, 500,000 people in Germany are diagnosed with cancer every single year. Unfortunately, this trend is on the rise. One of the reasons for this is the increasing age of the population. That's the main reason. Increasing age in general is not a bad thing. An increased risk of cancer, and as a result, perhaps a certain degree of suffering that will follow, is of course not desirable. Of course, we want to have quality years in the later stages of our life as well. And of course, many of us are actually afraid of getting cancer. Honestly, this doesn't exclude me. That is the biggest fear for me too. The latest statistics indicate that almost every second man and 2 out of 5 women will receive a shock diagnosis of cancer in the course of their lives. So cancer really does affect all or most of us. And I also want to note something very important before any fairy tales are written in the comments. The main reason for an increase in cancer cases is the increasing age of our society. And I want to mention a second fact. Cancer has never been as easy and successful to treat as it is today. Despite this, therapy is unfortunately still often unsuccessful, and this still happens too often. And that's why please pay attention to the 3 symptoms that, if occurring in combination at the same time, are also referred to as B symptoms. The most important thing, however, is prevention before you get it, so to reduce your own risk of cancer as much as possible. And there are ways to do that. How can I avoid getting cancer? Can you imagine that based on current research, up to 50% of all cancer cases, that is every second cancer are considered preventable? But what can I do to prevent that? What can you do to reduce your own personal cancer risk now? And the answer to that question is actually very simple. And you actually hear it again and again, but you just don't do it. A healthy lifestyle. But what exactly is a healthy lifestyle? Very briefly. First, enough exercise. Yes, that is very crucial. A lack of exercise will make you sick in many different ways. Last but not least, too little physical activity is also a proven risk factor for some specific cancers, typical examples being colon cancer, bladder cancer, and uterine cancer. There are, of course, other risk factors such as HPV, which are HP viruses, but the combination often makes the difference, and the right countermeasures are very obvious. Incorporate as much exercise and sport into your everyday life as possible, because exercise and sport seem to have such a positive effect on both the hormonal balance and the immune system that the risk of cancer decreases. And this can be shown very clearly through people who have dogs and have to walk them regularly. By the way, and this now also applies to cancer patients, i.e. patients who are already fighting cancer, as long as they feel physically fit enough to do so. They should do at least some sport. Sport protects against cancer. Secondly, the right diet. You can keep or achieve a healthy weight through proper nutrition. This is very important because it has been shown that at least 7% of all cancers can be the result of an increased body fat percentage. And secondly, certain diets and certain natural stimulants can increase the risk of people developing cancer at some point in their life. There are bad foods, so to speak, that increase the risk of cancer. And the most striking example of this is, of course, alcohol consumption. This can increase your risk of liver cancer, for example, but also laryngeal cancer and esophageal cancer. That has to set this drastically. Alcohol is poison. To give a figure, it is estimated that over 20,000 of all the new cancer cases in Germany are caused by this every year. And that already applies to small and moderate amounts. That means that 1 to 2 alcoholic drinks daily can be dangerous. The dangerous thing is always that you drink alcohol every day, you don't really notice it, and then you're 70 and sick. And of course, you can't always really trace the cause back to something specific. But we know that alcohol, and especially the breakdown products of alcohol, can react with our DNA and cause a lot of damage in different ways. Then, of course, you should stop smoking, logically. Sunscreen, that's something completely different. That's also a factor. Lack of sleep, stress. So these are all factors that influence our risk of cancer. But there are also other factors that we cannot influence, and they are crucial. Age, genetics, bad luck. And therefore, my last recommendation in this context, or 2 recommendations. First, pick out foods or a dietary pattern that will support the reduction of your risk of getting cancer, so to speak. And secondly, early cancer detection. Of course, neither of these 2 measures are a guarantee. There is no such thing as a guarantee. But as I said, the earlier it is detected, the better the chances of recovery. And that's why early cancer detection is important. But now let's come back to the B symptomatology. What is the B symptomatology? B symptomatics refers to the symptom triad, which means they include 3 symptoms. Those 3 symptoms are fever, night sweats, weight loss. And you have to differentiate, and that's what I'm doing now. Weight loss is defined as unwanted loss, so you lose weight without trying or wanting it. That weight loss is more than 10% of body weight in the last month or in the last 6 months. This is very important to know. And 10%, that's really a lot. A fever in this regard is considered a body temperature above 38 degrees that you have permanently and without reason. And what do I mean by night sweats? This doesn't mean that you're just warm and sweating a little at night, especially maybe in hot summer nights. We all sweat a little in those kind of nights. No, what I'm talking about is a soaked t-shirt, a soaked pillow in non-summer temperatures, and those are the things that I've experienced with patients. That everything is so wet that you really have to change the bed linen. Night sweats, do I have cancer? So I want to talk about that specifically again. Sweating is a natural process. Through sweating, our body conducts excess heat from the inside to the outside and thus ensures the necessary balancing of the temperature. And this regulatory system is important, among other things, but especially during physical activity. Of course, in warm weather or also with fever. You sweat even when you sleep, but since you are sleeping, you don't notice it immediately. This is very important. We probably lose a total of 1 liter of body fluid every night when we sleep. However, certain conditions can cause the body to release more heat at night. For example, if the bedroom is overheated or if too much alcohol has been consumed. If you drink a lot of alcohol, you sweat more at night, or if your dinner was particularly spicy, for example. But also prescribe drugs that stimulate the metabolism. Of course, illnesses and stress can also cause you to sweat more at night. From a medical point of view or a doctor's point of view, sweating at night are considered night sweats if you sweat at night over a longer period of time. And sometimes it can be so bad that the pajamas and the bedding are soaked so that you really have to replace them, sometimes more than once a night. And those affected sometimes wake up naturally and then have to change their clothes or even take a shower. Patients have also reported this to me when I was working in the oncology ward for a while during my practical year. The heavy sweating is not caused by a room temperature that is too high or a blanket that is too warm, for example. Anyone who suffers from these kind of night sweats usually feels sleepy, not recovered and exhausted the next day. This, of course, also increases the risk of a cancer progressing further and further. There is usually no excessive sweating during the day, which is important to note. Night sweats should therefore not be equated with other sweat production disorders that occur independently of specific times, so not exclusively at night. This is called hyperhidrosis. Those also occur during the day. Night sweats are also known as nocturnal hyperhidrosis in medical terms, just for your information. But let's go back to the symptoms. The B symptoms that come with cancer are caused by increased cytokine production by the cancer cells. And in the initial diagnosis of lymphoma, for example, which is a specific type of cancer, these B symptoms are found in over 80% of patients. So these B symptoms are particularly typical for lymphomas. And if we talk about patients with other tumors, such as colon cancer, kidney cancer, liver cancer, and other types of cancer. In up to 30% of cases, it is this fever, 38 degrees, and also these night sweats develop as the disease progresses. Fever due to cancer? And the causes of this fever are hormones or hormone-like substances that are released by the tumor, or sometimes it is a defensive reaction of the body or immune system against the tumor. In addition to this, fever attacks sometimes occur when the existing tumor spreads, which causes so-called metastases to form. Since the immune system of cancer patients is naturally already weakened, because that's what happens if you have cancer, they are naturally more susceptible to colds and other infectious diseases. So this can also be the trigger of a fever. This is very important for you to understand. However, this would not be one of the B symptoms because the fever is a consequence of the infection, so to speak. That's why it doesn't belong to B symptoms. Remember the following. If you have a body temperature over 38 degrees for no reason, no apparent cause, then that would be, so to speak, part of the B symptoms. Weight loss. Do I have cancer? And this symptom is fascinating. Often, at the beginning, you are happy when you somehow lose weight without trying and don't even know why. Some types of cancer, for example, breast cancer, can, on the other hand, lead to weight gain. This is also important to know, but the majority of cancer cases are accompanied by unwanted weight loss. And that's what's typical about cancer. Unintentional weight loss if you don't stop it, and the tumor changes the metabolism, and by doing that, of course, also weakens the body. Every second person that is diagnosed with cancer has already lost significant weight before being diagnosed. Some of them even over 10% of their original weight they had before, so they have become really skinny. And the loss of that amount of body substance can also be very dangerous. Of course, because in addition to fat mass, the important body protein that our muscle consists of is lost. The body's muscles need this body protein in order to function, just as it is very important for the immune system and also for maintaining strength, good health, and much more. So this unintentional weight loss can also have dramatic consequences even for patients who are already overweight. It's really bad when you say the following. Let's say an overweight person loses a lot of weight and you say, well, it won't hurt the person to lose a lot of weight. No? This is part of the AB symptomatic, so to speak, which is an unwanted weight loss. You definitely do not want that, since it can also lead to malnutrition, lack of nutrients, and more. Therefore, any unclear or unexpected weight loss, if you cannot explain where it came from, even if it is only a few kilograms, should always be discussed with your doctor. Therefore, please remember this. Unintentional loss of more than 10% of body weight in the last 6 months might indicate cancer. Weight loss in people with cancer has several causes which can naturally reinforce each other. So I really want you to understand this. Why does this even happen? So let me explain what happens. The tumor, the cancer, causes a change in the metabolism of its host. The metabolism is inhibited by the formation of new cells, and as a result, body protein is then also broken down to a greater extent. The body will then enter into a constant state of inflammation, and this state then also promotes the breakdown of protein and fat mass. And that will not only result in a continuous breakdown of muscles, but also in a deterioration of the immune system. At the same time, side effects of tumor therapy can also have an impact. This is another aspect that I haven't discussed yet, such as pain in the gastrointestinal tract, nausea, vomiting, pain when swallowing, inflammation of the mucous membranes, or constipation, possibly caused by certain medications you are taking. These side effects can make it more difficult to eat because you have less of an appetite. The psychological stress caused by the cancer diagnosis naturally also puts an additional strain on the appetite of many of those affected, which is a very important aspect. All of these influencing factors can lead to the cancer patient not being able to consume sufficient food or energy. And this despite the fact that, according to the current guidelines, cancer patients need at least 50% more protein than healthy people. This is very important to keep up with the consumption. The daily protein gap that can arise is really dramatic in some cases. And too little protein and too little energy intake can lead to a deterioration in nutritional status that will result in increased weakness, that will then lead, for example, to a reduced quality of life, etc., especially in cancer patients. And very important, I really want you to hear this. You cannot starve cancer, it doesn't work. This is complete nonsense. This statement is horrible and harmful. The increasing fatigue that is the result of malnutrition often leads to cancer patients moving very little. And this further increases and accelerates the loss of muscle mass. So as you can see, it's a vicious circle. Let me emphasize one thing once again, because it is very important to me and this topic is so relevant and sensitive. All of the symptoms I have just mentioned and also the medical conditions can of course have completely different, perhaps much more harmless causes. Please remember this. What is rare and what is common is common. However, if these persist over a longer period of time, it is always advisable to get to the bottom of the matter. I would also recommend that you find out which preventive examinations you are entitled to at your age, for example, from your family doctor, dermatologist, or gynecologist. And again, if possible, look out for yourself and take matters into your own hands. So have a healthy lifestyle. Diet and exercise are crucial for a healthy lifestyle. And you should avoid certain risk factors as much as possible. However, of course, you have to enjoy life and have fun. It's all about the balance. I hope you enjoyed watching the video. Feel free to give a thumbs up or leave a comment under the video. Let's discuss this. So write down whether you have had some B symptoms yourself, or maybe you have them now and you think you might have cancer. Thank you very much and stay with me.